It's never too early, it's never too late to build healthy habits, so start today.
Hello and welcome back to episode 3 of Parenting is a Lifestyle, the podcast where we focus on the importance of healthy habits right from the start of a child's life. When we as parents understand the impact of our decisions on our children, we are more likely to make positive lifestyle changes that reflect these priorities, influencing both our own and our children's health in meaningful ways. I'm Dr. Richa Agnihotri, a community pediatrician and board certified in lifestyle medicine through the American College of Lifestyle Medicine. Today, we're going to be talking about a topic I see very commonly, even when it's not the reason a child was referred to me. For example, I often come across it in kids referred for behavior related to school or eating concerns. What am I referring to? Constipation. Specifically, functional constipation, where medical causes have been ruled out. Now, as always, please remember that this episode and all podcast episodes are intended as general information and not specific medical advice, so please speak with your child's doctor or healthcare provider for individualized recommendations. We'll be focusing on lifestyle habits specifically that support healthy bowel habits and bust some common myths along the way. The series is a 3-part series: Routines, Mindfulness, Foods and Movement, Lifestyle Tips for Better Bowel Health in Children. Part 1 is on what is constipation, why do kids get it, and what should I look out for as a parent. Part 2, which will be released next week, is myth busting and lifestyle or parenting strategies to support healthy bowel habits. And Part 3 is a summary with evidence-based tips to support your whole family's bowel health. Now let's dive in. What is constipation and why does it happen in children? Functional constipation is very common in childhood. It happens when stool or poop backs up in the bowel instead of moving forward regularly as it's intended to. Signs that parents need to look out for are if the stool frequency is less than 3 times a week, there are very large poops, we call them large caliper stools, that can be blocking the toilet sometimes, straining during bowel movements, painful bowel movements, stool accidents. These are known as encopresis. So sometimes there can be loss of control of the bowel, and children may come with a smear in their underwear or even larger amounts. Sometimes it could be when children feel like they have the urge to go and need to make it immediately to a toilet, or they'll lose control. So there are different ways that children can describe this. More frequent urination or accidents, difficulty passing urine, or even urinary tract infections, bright red blood in the stool on wiping on the toilet paper at the end, and behavior problems or irritability. Constipation can really affect a child's quality of life. It causes pain, routine disruptions, behavior issues, and even messy accidents, peeing and pooping alike, which may even strain the parent-child relationship. Sometimes parents respond in certain ways that can impact a child's developing sense of connection with their gut, but also their relationship with parents. So while toilet training or potty accidents can sometimes be frustrating for everybody involved, it's important for parents to be mindful of reactions, tone of voice, the language that is used around stools, avoiding negative experiences around the toilet and around the words that are used, particularly avoiding shaming or talking about poop in negative ways, calling things bad or dirty or gross or smelly. These are really important things to avoid doing around anything related to bowel functions. It's very important that children understand that this is part of normal, healthy life. Constipation can also worsen other symptoms. Imagine having abdominal pain all day or periodically throughout the day. This could impact your child's emotion regulation, their ability to focus, pay attention, and learn, and even their social relationships. And it can mimic other conditions like ADHD or anxiety. And often children with other conditions may also experience constipation for various reasons. Often constipation signals a need to check in on your child's daily routines, their environment, and ask yourself a few questions. What does their day-to-day look like? What's their routine? Is toileting part of the routine? Is it a calm part of the day that has dedicated time? Or is it rushed? Is it stressful? What do they eat and drink in a day? How active are they? Are they sleeping well and regularly? Have there been any recent changes or stressors that brought the constipation on? How is your connection with your child right now? We'll explore all of these factors more deeply throughout this episode and in upcoming ones. It's really important for you to understand the pathophysiology, or how constipation happens. But in order to understand constipation, we need to understand how poop is made. Well, we eat food. Our teeth, tongue, and salivary juices begin breaking it down, forming a bolus of food that then becomes easy to swallow. It travels down the esophagus, which is a muscular tube in our gut, down to the stomach, which again is a muscular structure that churns the material, and it also has digestive enzymes and acid that further breaks the food down. This food then moves in a mushy texture into the small intestine, where nutrients like protein, carbohydrates, fats, minerals are absorbed and taken to other parts of the body where they are utilized. Other organs like the liver and gallbladder are also involved in this process. Now, it's important to note that poop is moving down the gut or GI tract due to muscular contractions that happen in the muscular lining of our gut. This is known as peristalsis. The muscle contractions are coordinated, so one part contracts to push things along to the next section and so on. So imagine squeezing icing sugar out of a plastic cover. Eventually, this mushy poop enters the large intestine. Here, water is removed from the stool. Imagine a dehydration device sucking out all the moisture. The stool then becomes hard here, and it's starting to look a lot more like the poop you see in the toilet. The contractions continue as the stool is becoming drier and harder than that original mushy consistency that started in the small intestine. Eventually, the stool is squeezed out as poop. Now, here is the problem. If your child holds their poop in, which is a common trigger, the stool sits in the colon or large intestine for longer. More water then continues to be absorbed, making the stool drier and harder over time, increasing the likelihood that it will be painful to pass. Meanwhile, more stool keeps building up. This leads to larger and harder poops that may cause small tears even. These are known as fissures, resulting in bright red blood. It can also then trigger pain as well. This painful experience can lead to fear or anxiety around pooping, and this can stop them from wanting to poop next time. So the next time they feel the urge, they may actually hold it in. This is known as withholding. And the cycle of withholding then worsens constipation again over time as new poop continues to build up. The water continues to be absorbed out, and the poop becomes drier, harder, larger over time. And over time, that bulk of stool continues to build up, and it may stretch and weaken the muscle wall, leading to more difficulty in the gut's process of trying to squeeze that poop out through that process of peristalsis. The poop then continues to get drier and larger and worsens the abdominal pain. It may also press on nearby organs, causing urinary issues like difficulty passing urine, and therefore increasing the risk of urinary tract infections, and also can increase the frequency of passing urination or passing urine. It can also lead to behavior challenges and focusing difficulties at school, as mentioned earlier. Imagine trying to concentrate while being in constant discomfort, or even periodic and unpredictable discomfort. It's not easy. Now, I'm going to dive into this in a little more depth in the next episode, but I hope you found this helpful. Many of the families I work with certainly do find understanding the background of why constipation happens important to understand in terms of putting the whole picture together to figure out why medication is needed, why certain lifestyle strategies help as well. Now, I'll be diving into more of those lifestyle strategies in the next episode, so be sure to check it out. Sign up for our newsletter on the parentingisalifestyle.com website. You can find the podcast on YouTube as well as on other platforms for podcasts, and follow us on Instagram at Parenting is a Lifestyle. Please rate, comment, and share, but it really helps to support the show when you engage. And feel free to message us with feedback or topics that you'd like to hear about. Thank you for being part of the community of lifestyle parents, a non-judgmental space where our motto is it's never too early and never too late to build healthy habits, so start today. In part 2, in our next episode, I'll be covering myth-busting and practical strategies to support your child's healthy bowel habits. Until next time.
It's never too early, it's never too late to build healthy habits, so start today.